Hello, everyone. We're going to go ahead and get started. I know we still have quite a few folks who are coming in last minute, so that's not a problem. If you're just joining us, we're really excited to have you, and we'll kind of get this underway. My name is Ryan Palm. I work in the alumni office at Mercyhurst, and our team is excited to launch this series of Lunch with Lakers. Our office and the entire university, probably like many of you, are working from home at the moment where the university is closed, and therefore we are doing the best we can from home to try and continue the mission of educating our students and helping Mercyhurst along the way. And we figured since we're all stuck at home, we might as well get together once a week and have a conversation about how Mercyhurst is dealing with the COVID-19 coronavirus situation, get you to introduce yourselves to some of our faculty, staff, administrators, all of whom are working really hard, literally now behind the scenes of their own homes to help our students in need every single day. So we hope that this will be a weekly series with varying students, faculty, staff from different topics. We envision the first few, for sure, of our series will be focused on issues related to the COVID-19 situation, though we do hope that this series will outlast the effects of this coronavirus situation and we'll be able to continue bringing you guests from Mercyhurst for weeks and months to come down the line. So there's a couple of housekeeping items I want to cover as we go forward here, just as we're getting started with our very first episode. I think many of you are experiencing the same thing, but this level of virtual technology is new to many of us. So we're literally figuring this out as we go along, which is great fun. So I ask for your patience if things are a little wicky or waggy. We will do our best to try and keep up with everything, but let us know if things are not working well for you on your end. We are joined by Lindsay Frank from our alumni office as well, who is in the chat room. If you're unfamiliar with Zoom, depending on your device, whether it's a phone or a computer, somewhere on your screen, you should be able to find a function for chat. Usually if you just click that, the chat window will appear, and you can go ahead and leave a message in that space, and we will do our best to address it if it's something that's of concern. If you have questions or feedback, you're more than welcome to leave it in that space as well. Depending on how this goes, we may have time for a couple questions at the end, but we will do our best if you leave questions in the chat to try and get those to our speaker each week and see if they will be kind enough to answer those as we go forward. Finally, we will plan to run this speaker series weekly. I'll talk about our next guest towards the end. But for the time being, please make sure you follow us on social media. You're paying attention to your email. You're keeping up in the loop with what we're doing and how we're going about it. And we will do our best to try and communicate that as broadly as possible, so to capture as many folks as possible. Please feel free to circulate this link to anyone out there that you think might be interested, whether that's fellow alumni, faculty, parents, students, the neighbor who's looking at colleges, maybe wants to learn a little bit more about Mercyhurst. Hopefully this is a great chance for that as well. So please feel free to spread that link as widely as possible. So I think that's all the housekeeping things we're going to get to. I want to go ahead and introduce our speaker and get started with our conversation. Dr. Lucy Thairu is an assistant professor of public health at Mercyhurst. I believe she's in her second year of teaching on the staff. She has over 15 years of epidemiology experience. She has taught at several universities prior to Mercyhurst, including Stanford University, which I assume many of you have heard of. She's also spent time consulting with UNICEF and the World Health Organization, among others, and really has a breadth of experience to share with us on coronavirus and COVID-19, but also what it means to be teaching students in public health at this very interesting time. So we're really grateful that she took some time out of her busy schedule to spend a little bit of time with us. Thanks very much, Dr. Thairu, for coming.
Thank you. Thank you for having me.
Wonderful. So why don't we get started by you just telling us a little bit about yourself briefly and how you got into public health in general.
So I did my undergraduate studies in France. So originally I'm from Africa. I'm from Kenya, as you can tell from the accent. So I did my undergraduate studies in France, and during my undergraduate studies, I chose to focus on protein, energy, malnutrition in children in Africa. So that was my honors thesis. And that was my brief introduction to public health. And then following that, I enrolled as a graduate student at Cornell University in Ithaca, New York, where I was a graduate student in nutrition. And there I focused on HIV and AIDS and mother-to-child transmission of HIV through breastfeeding. As you know, one of the routes that the AIDS virus can be transmitted is from the mother to the child during the act of breastfeeding. So that was my dissertation work. And then after that, I got this really exciting opportunity to be a postdoctoral fellow in infectious diseases at Stanford. So I was really excited. Again, I was working on the AIDS virus. And during my time as a postdoctoral fellow, I got to teach. I got to teach about the AIDS epidemic around the world to undergraduates at Stanford. So it was really an exciting time. So yes, so ever since I've been an undergraduate student, I've been interested in public health. It's been a long journey.
Sure. Well, that's wonderful and really fascinating. So how did you find Mercyhurst along that journey?
Uh-huh. So I was working as an epidemiologist at the Georgia state government. And I was looking to come back to the classroom. You know, I missed Stanford, I missed the students, and I wanted to teach again. I thought that my place was really in the classroom. And so I was looking for a job. And for some of you who are public health students out there, that resource that I use, the Emory job board from the Rollins School of Public Health, has a really great resource where you can find public health jobs, and they do a really great job of connecting employers to job hunters. And so I applied for this position at Mercyhurst. And I got really excited when they called me for an interview. So I came out here. It was in May, so the weather was really nice. And, I got to go on a campus tour. I got to meet different people on campus. And I also got to give my job talk. And I fell in love with the campus. You know, the students, the faculty, the on-campus dining. I just really, really liked Mercyhurst. So I was really excited when I was offered the position and told that I could start that fall of 2018. I was really, really excited.
That's wonderful.
Mm-hmm.
So this is certainly the COVID-19 coronavirus situation is challenging for many people, economically, health-wise. There's many wide unknowns as to what is going to happen here in the coming weeks and months. But at the same time, it must be a really interesting time for someone in public health to be experiencing this, using your expertise. I imagine it's an interesting topic with your students that you're teaching with. Can you kind of share some of how you've been handling the situation of late?
Yeah, so, this is really a great time to be an epidemiologist. All the tools that the epidemiologist uses to track diseases, figure out who's affected, who is more vulnerable to the virus. Now is really an exciting time for us epidemiologists to be in our field. Just the other day in March, there were epidemiological models that were published by the Imperial College of London showing how social distancing can be one of the most important public health measures in preventing coronavirus. Also measures such as hand washing. All of those are public health measures that have relied on epidemiological models. So it's really an exciting time to be an epidemiologist at the moment.
Sure, I can imagine.
Mm-hmm.
So as an epidemiologist, what has surprised you the most about the COVID-19 coronavirus situation?
Mm-hmm. Well, I think how the epidemic has unfolded in the United States. I think that, the United States is the third most populous country in the world. And in terms of nominal GDP, we have the world's largest economy. So two things going on. The first thing is that because we have such a large population, we have a large pool of people who can potentially become infected with the virus. So just there, right there, we have the numbers. So it's probably not so surprising that we have such large numbers of people who are infected because we're a large country. But on the other hand, we're the world's largest economy. It is really unfortunate that at the moment we're leading in terms of the cases of coronavirus. As of today, we had about 180,000 cases of coronavirus, COVID-19 in the United States. The state of New York is leading with about 76,000 cases as of today. New York City with 43,000 cases has also been really affected by this virus. So, as the world's largest economy, it really is unfortunate that we have been unable to have a public health system in place to be able to stem this exponential growth that we're seeing in viral transmission. So that has been the thing that has surprised me the most.
Sure. Oh, absolutely. Thank you for that.
Mm-hmm. Mm-hmm.
In your opinion, are we able to learn much about the handling of this epidemic from the countries around the world, such as in Asia and Europe?
Mm-hmm. I think we've learned a lot from China. Their cases started at the end of last year, and they have been more or less able to contain the virus by using certain public health strategies and measures, social distancing, travel restrictions, hygiene measures, contact tracing, which in epidemiology is really important, figuring out who's infected and who might they have come into contact with. And especially for a disease such as coronavirus that has such a high R0. R0 is the replicability rate. So the number of people who are potentially infected by someone who is infected would be something like 2 or 3 for coronavirus. So it's really important to figure out who has been in contact with a given case. So we learned a lot from China. Their experience has been really helpful. And we're also learning a lot from Italy. I think what we've learned from Italy is that there are people who are more vulnerable when it comes to coronavirus, people who are more likely to die. When we talk about case fatality, it seems like the number of people who are infected and who die, which is the case fatality rate, is lower in people who are younger. When you get to people over the age of 80, it is estimated that 18% of people who have coronavirus who are over the age of 80 might die. So when you stratify the case fatality according to age, for example, you're going to see huge differences. Overall, the case fatality is roughly 1% in different countries, depending on how great the healthcare system is. But in older people, we're seeing much higher rates of death compared to younger people.
Sure. Are there any specific resources or publications you might suggest for those of us that are constantly trying to keep up with the latest and greatest news?
Mm-hmm. So, I know that there's a lot of news out there. Some of it is incorrect and you have some more accurate sources of information. Personally, I'm relying on the CDC, the Centers for Disease Control. They have a really great website with wonderful resources about coronavirus. They have videos. I was looking on their website this morning. They don't have podcasts yet, but they do have great videos. They do have great slideshows, webinars, and some of the resources that they have are things that, even though some of us are not infected with the virus, we are affected. How do we deal with stress during this difficult time? even for our students, they are undergoing a lot of stress, having to move from living on campus to probably going back to live with their parents or living with their friends or relatives. It's been a stressful time for most everyone. And so how can we deal with that kind of stress? And you will find resources such as those on the CDC website. So I find it a really great place to get information, accurate, up-to-date information about COVID-19.
Sure. Wonderful. That's great. So you alluded to it briefly, and I'm sure many of our alumni, friends, and parents listening out there know that Mercyhurst, like most institutions, transitioned to a remote learning situation where the vast majority of our students went back home and they are learning via computer and technology and video, which is obviously a very different situation than they have been used to during their time at Mercyhurst. Can you share a little bit about how that's worked with your classes, what's worked well, things you've learned maybe early on, this rather chaotic transition?
Well, I would say it's really been exciting to transition from teaching in person to teaching online. The use of video, the use of chat, some things that I am able to do in class, I'm no longer able to do online. So it's been exciting, but I just have been struck at how our students are excited and want to continue learning despite these challenges. Some of them don't have great internet connections, but they will still log in during class time. Our students are just, I have had students present their work through online teaching, and I've just been struck by the quality of their work. So I think, it's been an exciting time with some challenges, but the most exciting thing for me has been, seeing how well our students have responded to these changes and how eager they are to continue learning despite the challenges.
Do you present many of your lectures by video now? Is that kind of the standard means of communication for the students?
Yes, for me, I mostly communicate with my students via video. So I do have office hours. So I can speak with the students during office hours. I also have synchronous teaching. So our class times as they were before continue now, and we have synchronous meetings with the students.
Very good.
Mm-hmm.
I think we're safe to assume that this coronavirus COVID-19 situation will become a case study for public health education for quite some time to come. Am I correct in that assumption?
Absolutely. Yeah. So, the CDC, the Centers for Disease Control, has case studies that they have developed over time. For example, in my epidemiology 2 class at the moment, we are working on a case study that is of norovirus in the state of Vermont. And so in my classroom, I use a lot of these CDC case studies. Some of them are web-based and interactive, so that really makes students get engaged with the material. So I'm hoping that, the CDC will develop a coronavirus case study. Hopefully it'll be web-based. The really great thing with CDC case studies is that you can get a certificate when you're done, when you complete the case study. So not only would it be for students, for example, students at Mercyhurst, but even the general public can access these case studies and get a certificate after they have completed the case study. So I really hope that the CDC will put together their resources and their epidemiologists, and hopefully we can get a really great coronavirus case study out there sometime soon.
That's wonderful. I think many of our, especially of our alumni, may not be completely familiar with the public health program. So could you tell us a little bit about the types of careers that our public health students might wind up in graduation, and perhaps maybe not in an unusual year like this, but maybe something that's more traditional year in terms of graduation time?
Yeah, so some of the careers that our public health students can think of include becoming entry-level epidemiologists. You know, through our public health program, students will have the chance to have at least 3 epidemiology classes, epidemiology 1, epidemiology 2, and mental and psychiatric epidemiology. So right there, they've probably even got more epidemiology courses than they would in a Master of Public Health program. So I see no reason why our students shouldn't be entry-level epidemiologists. Another job our students can have is as entry-level statisticians. You know, we do have a class in biostatistics, and we do everything from descriptive statistics to sophisticated survival analysis. And so I see no reason why our students shouldn't become biostatisticians. But from my experience, many of our students have continued with their studies after Mercyhurst. Some of them have gone into Master of Public Health programs. Others have chosen to become physician assistants. Others have gone into medical school. And I think that this is really great as well. You know, for example, you know, a student from Mercyhurst who has an undergraduate BS or BA in public health, who goes on to med school, is in such a great position to be a medical epidemiologist. You know, to do work that some of our leading doctors and epidemiologists are doing at the moment. You know, that would be such fantastic training for a student to pursue medical school after having gone through our public health program.
Wow, that's wonderful. So I think
Mm-hmm.
one of our closing questions in every one of our Lunch with Lakers episodes is going to be the same, because it's one of my favorite questions to ask all my peers. And it's very simple and straightforward, but what's your favorite part of Mercyhurst?
Wow, I would just start by saying that I love Mercyhurst. From the 2 years ago when I was interviewing for my position at Mercyhurst, there were many, many things I liked about the university. One of the things that I've come to appreciate is the small class sizes. You know, we have classes with 10 to 25 students. So you get to know the students by name, you get to know their strengths, their weaknesses, and you can really guide them in their careers because you know them really, really well. So I've really enjoyed the small class sizes and the possibility of getting to know students really well. And then other things, you know, I really like my colleagues at Mercyhurst. Mercyhurst is a great place to work in. You know, colleagues are really supportive, and especially now as we've transitioned to online teaching, you know, some of our colleagues that have more technical skills have been helping us along as we transition to online teaching. So the support from colleagues is also a really great thing about Mercyhurst. It's really a great place to work in.
Wonderful. So my last question will be, putting your epidemiologist hat on, what basic tips would you offer us as we go forward with the next few weeks of continued social distancing and all the measures that are associated with that?
Mm-hmm. I think much of it, and I would orient you to the CDC website about tips for living during these difficult times. You know, we are enclosed spaces for long periods of time. I think, you know, eating healthy, exercising as much as you can, keeping away from drugs and alcohol, just trying to be as healthy as possible within the confines of living in enclosed spaces. And I
Wonderful.
think that's in my class, one of my classes, my mental health and psychiatric epidemiology class, one of our students presented a really great presentation about, you know, how to live during these stressful times. And she had some really, really great tips, you know, exercise, eating healthy, you know, meditation, mindfulness, all of those strategies that can help you live healthily while living in a confined space.
Well, that's wonderful. And this was all really great information. We really appreciate you taking a little bit of time to share it with us. And we certainly say thanks to all those who are joining us today. Just from looking at the list of who's on the line, I see representatives from many different decades of Mercyhurst, both near and far to Erie, Pennsylvania. And it's been wonderful to see so many familiar names that are joining us today. We will have another episode of Lunch with Lakers next week. It'll be Wednesday at noon, just like we said. It'll be Dr. Chris Mansour. Stay tuned for information on that link. You can go to the website that was featured in the chat. It'll be all over social media, in our email, and all those different types of things. So we look forward to hopefully sharing some of that information with you in the coming weeks ahead. You can also always email us at alumni@mercyhurst.edu with any questions regarding this series or anything else Mercyhurst related. We continue to man that station, and we will be happy to get back to you. We're working remotely, so if you call us, we may not answer right away, but we'll be happy to get back to you at our earliest convenience, whether that's by phone or email, and we'll be happy to do that. If you have questions, again, please send them to alumni@mercyhurst.edu. We'll be happy to forward on to Dr. Thairu, and we will look forward to seeing everybody again soon in the coming weeks. All right, thanks very much, and have a great day.